Welcome to the deep dive. Today, we are taking a necessary, though difficult, look at a really serious public health crisis that unfolded in Kuwait. It's a tragedy that has disproportionately hit the Asian expatriate labor community there.
It is a heavy topic, and our aim today, really, is to pull out the essential lessons for you. We're looking at the immediate human cost,
Yeah.
the scale of it all.
Right.
Then there's the terrifying science behind the specific type of poisoning, methanol toxicity.
And critically, the context, right? The black market conditions driven by prohibition that, well, arguably made something like this almost inevitable.
Exactly.
Okay, let's try and unpack this then. Looking at the reports coming out of the region, I mean, we're not just talking about some unfortunate incident. This was a situation where routine, albeit illegal, transactions turned fatal almost instantly for many people. The headlines were just devastating.
Yeah, and to frame the scale for you, the sources confirm 13 Asian expatriate workers lost their lives right away. It really highlights these profound vulnerabilities. This wasn't some slow-moving thing. It was a mass poisoning. Hospitals were just completely overwhelmed very quickly.
Let's focus on those numbers for a second, the stats that really define the sheer scale of this emergency. It's far more than the fatalities, sadly. We're talking more than 60 others hospitalized.
That's right, often fighting for their lives against a poison that acts incredibly fast.
So the total confirmed cases attributed to this specific batch of locally made methanol-laced alcohol, it climbed to nearly 63.
Almost 63, yes. But the real horror, I think, is in the speed and the nature of the symptoms people experienced.
Yeah.
Victims were coming in with severe headaches, constant vomiting,
Awful.
and blurred vision. And that often deteriorated into coma or, tragically, death within just hours.
Given that kind of immediate life or death timeline, how did the healthcare system actually cope? How did they manage to scale up fast enough to save those 60-plus people who were admitted?
Well, it must have been a monumental effort, really focused on immediate intervention. The long-term medical data, it tells us just how serious these cases were.
How so?
We know that 31 patients ended up needing mechanical ventilation. Their respiratory systems were failing because of the poisoning.
Wow.
And get this, a staggering 51 individuals required urgent kidney dialysis. They were literally trying to filter the toxin out of their bloodstream.
It's just incredible pressure on the system. And what about the long-term cost for those who survived? The sources mentioned some truly catastrophic, life-altering injuries.
Yes, absolutely. For those who didn't succumb immediately, the damage is often permanent. We know that 21 individuals have suffered severe or permanent vision loss.
Blindness.
Partial or total blindness, yes. And when you realize the victims were primarily construction and labor workers,
Yeah.
well, this kind of injury means the permanent loss of their livelihood, their ability to function. It just underscores which population was most impacted by this unregulated black market trade.
So we have the devastating human cost laid out. But this leads us directly to the how of the tragedy, doesn't it? We need to transition now to understand the silent killer itself, methanol.
Right. And what's fascinating and frankly terrifying here is the difference between what people thought they were drinking and what they actually consumed. We all know ethanol, that's the alcohol in, standard regulated drinks.
Beer, wine, spirits, yeah.
Methanol is its chemical cousin, but it's completely different in function. It's an industrial solvent, sometimes used as fuel. It's not meant for human consumption at all.
And it's the toxicity that we really need to understand. Why is methanol so much more deadly than ethanol, especially when we're talking about relatively small doses?
Well, methanol itself is dangerous, yes, but the true killer is actually created after you drink it. When your body, specifically the liver, tries to metabolize methanol, it processes it into highly toxic byproducts. The main one is formic acid.
Formic acid, that sounds aggressive.
It is extremely aggressive. You can almost think of it like battery acid circulating inside your system. It attacks internal organs.
Oh, wow.
And it has a particular affinity for the optic nerve. That's why permanent blindness is such a common and devastating outcome of methanol poisoning. It doesn't just make you sick. It fundamentally breaks down parts of your nervous system.
And the deadliest feature, particularly in this black market context we're discussing, has got to be the deception factor. How can these bootleg suppliers possibly get away with substituting an industrial poison for consumable alcohol without the buyer having any idea?
Because they look and smell identical. Ethanol perfectly mimics the appearance, the consistency, even the smell of ethanol. So in an unregulated operation where there's no testing, no oversight,
Right.
A producer looking to drastically cut costs or just maximize their profit margin might substitute the relatively expensive safe ethanol with cheap industrial-grade methanol. The buyer, who might be drinking quickly, maybe in rough conditions,
Mm.
they have absolutely no warning, none at all, until that formic acid starts building up in their system.
Which makes time absolutely critical. If someone somehow realizes they might have consumed this stuff, what's the immediate medical strategy? What can doctors even do?
Time is the single biggest enemy here. The symptoms worsen incredibly rapidly. So the medical team needs to administer antidotes like fompazole immediately, often while they're simultaneously setting up invasive procedures like hemodialysis, the kidney filter.
Omeprazole, that's not a household name. You mentioned it blocks the body from creating that deadly formic acid. Can you explain that in simple terms? How does it work?
Yeah, sure. Think of fompazole as a kind of chemical decoy. It floods the patient's system, and it essentially distracts the liver enzymes that do the processing.
Okay.
So instead of those enzymes latching onto the methanol to convert it into the deadly formic acid, they latch onto the fompazole instead. This buys the medical team crucial time.
Right. Time for what exactly?
Time for the body, or more likely the dialysis machine, to filter the original unprocessed methanol out of the system before it can be converted into the real poison.
That's a really powerful distinction. Okay, so the immediate and crucial advice that came out in the public health warnings, which we should probably reiterate, is absolutely paramount then.
Absolutely.
Things like seek emergency medical help immediately. Do not consume unlicensed or homemade alcoholic drinks, no matter the source. And report any suspicious distribution you might see.
And that advice is specifically targeting the environment, the conditions that allowed this tragedy to happen in the first place. Knowing the speed and severity of this poison, we really have to look at the context of the illicit trade itself.
Which brings us squarely to that core issue, the context of illicit trade in Kuwait. The sources are very clear. Kuwait strictly bans the sale and public consumption of alcohol.
Correct.
Hmm.
And this policy, well, it creates an inevitable economic and logistical reality, doesn't it? Despite the ban, there's clearly significant demand. Primarily, it seems, within these sizable expatriate labor communities. People living and working in conditions often far removed from the main city centers.
So this raises a really important question. What is it specifically about prohibition that creates the conditions for this kind of toxic substitution to happen?
Well, when something is completely banned, you essentially eliminate all regulatory oversight. There's no quality control whatsoever.
None at all.
Exactly. And that lack of regulation is directly linked to the economic incentive to use methanol. Legal alcohol production has standards. It guarantees ethanol quality. But illegal production, it prioritizes cheapness and volume above all else.
And industrial methanol is just way cheaper.
Significantly cheaper than acquiring black market ethanol, yes.
Right.
Which makes it the financially attractive, though obviously morally bankrupt choice for these illicit manufacturers.
The investigations pointed directly to where this specific deadly batch was purchased, Al-Shuyuk Block 4. What does that location tell us about the supply chain and who was being targeted?
Well, Al-Shuyuk Block 4 is apparently notorious for illegal alcohol sales, and it targets very specific demographics. This isn't liquor being sold covertly in, say, high-end hotels or private residences. This market specifically targets expatriate laborers. You're talking about a population who often live in worker camps or maybe segregated housing. They generally have lower wages, and they face extreme difficulty accessing regulated goods, even if they had a legal avenue, which they don't.
So they rely on these very localized underground networks for supply.
Precisely.
So this paints a pretty clear picture, doesn't it? A vulnerable population being exploited by dangerous cost-cutting measures, enabled by the very system of prohibition itself. Because the market is underground, the cheapest, and in this case deadliest, shortcuts become the most profitable ones.
That's the bigger picture, exactly. When basic safety is effectively outsourced to the black market, the consequences inevitably fall hardest on those who are already the most vulnerable.
Okay, so once the full scale of the tragedy became horrifyingly clear, what was the official government response, both medically and legally?
The response seems to have been pretty comprehensive and immediate. The Ministry of Health, along with security agencies, launched a sweeping investigation. The goal was twofold: identify and dismantle the distribution networks responsible.
So dealing with the poisoner and the poisoned, essentially.
Correct. It had to be a dual approach.
What were the practical steps they took?
Well, widespread raids on suspected illicit breweries, for one, trying to dismantle this specific operation or operations that were using methanol, Methanol, which is sometimes illegally diverted from legitimate industrial supply chains, by the way.
Right.
And alongside the raids, they issued immediate, heightened public health warnings, trying to prevent any further exposures.
And the international connection here must have been key, given the victims weren't Kuwaiti citizens.
Absolutely vital. The government engaged immediately with the relevant embassies, primarily various Asian embassies, to assist the affected nationals.
What did that involve?
Things like providing medical information to the families back home, logistical support for, sadly, repatriating bodies, and also ensuring that those who were hospitalized received continued, often quite specialized care. It's complex, treating non-national victims far from their homes and support systems.
This entire deep dive, while definitely difficult, it really underscores the urgent need for awareness about the dangers of illicit alcohol. Particularly, it seems, for migrant workers who are just inherently more vulnerable to these black market sales simply because of their working and living circumstances.
Mhm.
The message seems crystal clear. The risk is immediate, it's catastrophic, and unfortunately, it seems like a predictable outcome of these specific market dynamics created by prohibition.
Yeah, and the authorities are still urging residents to heed those warnings and absolutely avoid any unregulated beverages. This wasn't just some random freak act of contamination. It was a consequence of economic choices being made in the shadows with devastating results.
This has been a profoundly sobering deep dive. We've covered the swift, brutal severity of methanol poisoning, the high vulnerability of the community targeted in this instance, and the persistent danger created by unregulated markets that often stem from strict prohibition policies.
And, if we just connect this to the bigger picture for a final thought, this tragedy really forces us to consider how prohibition policies, even when they're rooted in, say, cultural or religious law, can inadvertently create these incredibly dangerous black markets.
Right.
And in these markets, the pursuit of profit just completely overrides basic safety. It makes the most vulnerable populations like migrant laborers who might rely on cheap, accessible goods. It makes them reliant on toxic, unregulated products simply to access something that is otherwise completely unavailable to them. The policy might intend to eliminate consumption, but in reality, well, it often just transfers extreme risk onto the people with the fewest defenses against it.